So, your syllabus is something like that. You will have multiple tables in your practical. The first thing you will have is OSPE. OSPE cards. Cards will be given, a problem will be given and the questions will be asked. Okay. Everyone will get a separate card with a separate problem and you all have to write down the answer, the provisional diagnosis and the other questions that are asked along with the clinical scenario. It is a clinical question. They will give you a clinical scenario and 4 or 5 questions. You have to give the provisional diagnosis and you have to answer the questions asked. This is very important table and from this you will be asked subsequently in VIVA, you will be asked questions from this. Next comes general pathology. From general pathology, more or less everything will be asked in the VIVA. You have to read all the chapters very carefully, you have to attend your theory classes and general pathology mostly you will be asked in the VIVA table. There is a separate table for general pathology. So, you have to attend your theory classes and you have to attend your practical classes also, and general pathology topic discussion that will be done after you complete your practical syllabus. After that these things will be done, OSPE and all these things will be done. Next comes hematology. In hematology you have to read all the diseases and whatever is there, that will be taught in the theory class. In practical class what you have to do, first thing you have to do is hemoglobin estimation. There are various methods of hemoglobin estimation. You have to do the hemoglobin estimation and you have to do it by yourself and you will be given marks upon that and you will be asked questions on that. That you have to do practically. Your examiner will see what you are doing and will ask you questions on that. Next thing you have to do is WBC counting, RBC counting using the Neubus chamber, and Neubus chamber also comes as in the instrument tray, and in the instrument tray you will be given the Neubus chamber and you will be asked questions about the Neubus chamber. Okay. Clear? I am giving you the basic idea what you all have to do in the practicals. From next week the real practicals will start. Next thing you have to do is blood grouping, ABO and RH, ABO grouping and RH typing. This also you have to do by yourself and you will be given a blood sample. You have to do the ABO grouping and the RH typing, and then the examiner will go and see your method and you will be asked questions on that method, on what you have done, what is ABO grouping, what is RH typing, what is RH positive, what is RH negative, what are the other blood group systems, like this. These type of questions will be asked. The next thing you have to do is staining of peripheral smear and examination of peripheral smear under the microscope. So, you have to make a peripheral smear on a slide that we shall teach you, and you have to stain it with Leishman stain. The process will also be taught. You have to do it by yourself and then you have to do a differential count, and for that you have to learn the morphology of all the 5 types of WBCs. You already know, you have read it in the physiology book. You have seen the WBCs in the physiology classes. You know what are the types of WBCs? Okay. This thing you all have to perform in this practical in pathology also you have to do, and later on if you become a pathologist, this is going to be your bread and butter. Okay. Then another thing comes bone marrow examination. You have to just identify bone marrow. Bone marrow needle, you have to identify which one is bone marrow aspiration needle. There are two types of aspiration needles, these will come in the instrument tray. Bone marrow biopsy needle you have to identify, and you will be asked its uses, where you will perform a bone marrow. These will be asked all theoretically. You won't have to do a bone marrow. You have under the microscope you don't have to report a bone marrow, but you will have to read it theoretically. You have to answer the questions. You will get the bone marrow aspiration needles on the instrument tray. Now, identification of parasites. Malaria parasite you have to identify under the microscope. Okay. So, this is more or less hematology, and next Wednesday I shall take the first class on collection of blood. How do you collect blood? And there I shall give an overall idea of blood collection. What are the vials in which you collect blood, which vial is used for which test, and what is the order of draw, and what is gel vial, what is vacuum. You all will learn this next week. From next week I shall tell about all these things. So, you do not have to draw blood in the practical exams, but the vials will be there on the instrument tray, and you will be certain, suppose a purple topped vial will be given to you. What is this vial? What is the anticoagulant used in the vial? For which test do you use the vial? This kind of questions will come, and all the vials will be given in the instrument tray. So, this is all about hematology. The next thing is urine. Urine you have to theoretically you have to say what are the physical examinations, what are the chemical examinations, what are the microscopic examinations you have to say, and 3 chemical examinations you have to perform by yourself for sugar, for protein and for ketone bodies. These 3 you have to perform by yourself, and examiner will go and see and will ask questions on the methods. And other things like specific gravity of urine, pH of urine, what are the things you will see under the microscope, these are all theoretical questions. It will be asked during VIVA or during your practical exams. These all will be your theoretical questions. These will be asked. Now, coming to the specimens. Specimens in the museum, we have specimens. Most commonly given specimens are specimen of a femur with a tumor. You have to identify the specimen. First of all, you have to identify the specimen. You have to tell the mother tissue. Like if a bone is given, you have to say this is a femur is given. This is a femur, and then you have to show the pathology. Mounted, this is a wet mount specimen of femur, and then you have to describe the pathology. Showing a mass lesion, the lesion is this and that, whatever you see, and then you have to give the provisional diagnosis. Okay, the specimens are there in the museum. Those all will be taught in your practical classes. I am telling you about the whole syllabus, and this will be divided into your semesters. The next specimen is a specimen of gastric carcinoma. The stomach will be given. You have to identify first you have to identify that it is a stomach, wet mount specimen of stomach. Then you have to identify the area where the lesion is, and you have to tell your diagnosis. The next thing you will get is the specimen of uterus having a fibroid. You have to identify that it is a uterus containing a mass lesion, whitish lesion with in-hole patterns like this, and you have to give your diagnosis. That is leiomyoma uterus. This specimen will become a specimen of kidney with a tumor, specimen of breast with a tumor. These are cirrhosis of liver. These are the common specimens which come. And I don't think any other specimen will be there, but these 7 specimens will be there, and either the examiner will say choose one, then you have to choose the one you know the best, or they will choose one for you and you have to answer the questions, whatever questions they ask. And then you have the spotters. You will get 5 minutes for each slide, the histopathological slides. There you will get appendicitis, chronic cholecystitis, granuloma, it may be in a lymph node or lungs or somewhere else, a granuloma slide, and then cirrhosis of liver, leiomyoma. You will get these all you will get in histopathology slides, and few more are there. You have to check in the box, and these slides also you will be given the slides. You have to see the slides, you have to write the points, the identifying points, and then you have to write the diagnosis. And next comes the instrument tray. In the instrument tray you will have all the instruments. You will have urinometer, then you will have Westergrens, Wintrobes, bone marrow aspiration needle, all those vials. You can even get a tourniquet. What is this used for? Why do you use a tourniquet? How a tourniquet is used? Then the spinocan needle. What is the use of spinocan needle? You have to identify the instruments, and from there they will ask you the questions and you have to answer the questions. In general, there will be 4 tables of VIVA. One table will consist of general pathology and instrument, another table will be of hematology and specimen. These are the four VIVA tables, and your marks will be divided like that, and rest will be the practical classes. The practical you have to perform and you have to show the results and you have to answer the subsequent questions. Clear? So, this is the overall idea. Next class I shall discuss about how to draw blood and about the different kinds of vials used. Otherwise, I have taken examinations and nobody could even say why a EDTA vial is used. What is the anticoagulant? I have told them this is an EDTA vial. What is the anticoagulant used? They could not even answer what is the anticoagulant used when I was telling this is an EDTA vial. Even then they could not say what is the anticoagulant used. This was the condition of the students. So, make sure that you do not go through this. Start from the very beginning and things will be easier if you start early. If you think like, okay, I have just passed my first MBBS exams, let us enjoy, let us have party. No, you have to pass all the 4 MBBS exams, then your life will start. You have to read for the postgraduate examinations. So, this is only a small part. This second MBBS exam is a small part. You have to work hard from the first day. So, do not miss the classes, listen to your teachers and always read a book. Reading a book is much better. After reading the book, you can go through some YouTube tutorial or something which is authentic. Even ChatGPT is not authentic. Sometimes they also give wrong information. Okay. And as ma'am told, buy the books like that ma'am told. Harshmohan for theory and B. Chakraborty for practical. And if somebody wants to work harder, he or she can buy a Robbins or go to the library and read Robbins. Robbins is a very beautiful book, but it is full of information, and it is Harshmohan is like everything is given point by point. It is easier to write from Harshmohan in the exams, and Robin is full information packed. So it sometimes becomes difficult to read from Robbins, but Robbins is a very good book, fantastic book.